VA Secretary Doug Collins says the number of employees to be cut at the VA could change.
He says slashing 80,000 jobs is a goal, not a firm plan, and Democrats are trying to frighten veterans. He testified for the first time on Capitol Hill yesterday to the Senate Veterans Affairs Committee.
That there is a goal of looking at a 15% reduction. You have stated on several occasions already that I'm saying we're going to fire 83,000 employees. That is wrong. I would appreciate that being corrected because that's not true. I said we're looking at a goal of how many employees we have and how many employees that are actually working in the front line taking care. I have doctors and nurses right now that do not see patients. Is that helping veteran health care?
Yes, it does.
No, it does not. Not when I need those doctors.
Not
when I need those doctors in a clinic.
All right, here with us today, Republican strategist and founder and CEO of VetCom, Kate Monroe. Kate, great to have you in studio. You were there.
I was.
Doug Collins was going out. You know, if people don't know Doug Collins, this is not a shrinking violet.
No.
This is a strong, intelligent, accomplished human being. And it looked like Blumenthal was trying to go after him. What was your impression?
Well, you know, I sit on one side of the aisle, so to me it appeared like a lot of grandstanding and gaslighting for the entire time that I was there. It was interesting to hear from both sides of the aisle, but I have to say, what a calm and collected and articulate man he is. I was so impressed that he stood in the face of that adversity and stood up for veterans, constantly bringing the conversation to what's good for veterans. You're here talking about all these jobs and cutting, which you have no idea whether we're even going to do or not. Little are you talking about actual veterans. So I like that he brings the conversation back to them every chance.
Because he is one.
Correct.
As are you.
Yes.
So last week you were on with us, and you said that you were meeting with Doug Collins. Can you tell us about that meeting and how it went and what you advocated for?
It was actually so amazing. They put together a very small round table of, I think, 10 or 11 people. There were some veterans, some people who actually serve veterans. He came in and he was there for roughly an hour. His staff, we stayed for 3 hours, but he asked such interesting questions. He was really trying to get down to the heart of what veterans actually need. I actually gave him a 7-solution plan. I was able to talk to him one-on-one, and they're looking for solutions. They don't want the status quo. And I think, you know, I said to him, you know, you were a chaplain, and I was assaulted in the military, and it was really a chaplain that helped me navigate that space. And I would say to all veterans, this is a man who deeply cares about your success. Let's give him a chance. Let's not get so, you know, bent out of shape with what you're hearing in the media. Listen to what he's saying. Listen to what his plan is for you.
Give us some of what's on that 7 list, because you know, things need to improve for veterans.
Well, I think the number one thing is we do a poor job transitioning people. That's a part of the reason.
From what to what?
From being active duty
military
to being a civilian. And that short runway where they don't have time to take off financially is detrimental to them. So I said, you need to pair together with the DOD and work on the Skill Bridge program. There's companies like mine. I employ a lot of active duty service personnel who the second they become a civilian, now they have an excellent job and they have infrastructure of support. So they're not going to end up homeless. They have continuity of care because I'm going to provide them medical insurance. So that was one of the big things that we discussed. The second one was base camps. We need to get 35,000 veterans off the streets. We could put together these big forward operating bases for them. The other thing I said is, why don't you have more transparency with people's records? Why is it a mystery how you're deciding to rate and compensate them? Why do they have to fill out a FOIA request to get something that should live in their medical record? So these are just some of the things that I brought to them. But finally, I said, you operate like an insurance company, not like a veteran service organization. Your goal seems to be to deny claims and make things difficult and create an unnecessary minefield in front of veterans. And you wonder why the suicide rate is 22 a day still to this day.
Now, in the clip that we aired prior to you coming on, he was going at it with Blumenthal, who was accusing him of cutting veterans' jobs, that the DOJ cuts are coming, and 80,000 has been the number that's been reported by the mainstream media. He was pushing back and saying, no, we're looking at 15% cut across the board. Kind of, what is your feeling as a veteran about these cuts? Should they be made? Can they be made? Are they necessary?
I don't think they're going to get to anywhere near the 80,000 number. I think that they'll cut more like 30,000. But you have to think, over the last few years, we augmented the staff by more than 50,000, and they didn't see one more person in the healthcare system. They didn't adjudicate any more claims. So who did you hire? In what department do they work in if they're not working on veterans claims and veterans health? I think that's one thing to consider. And I think that our company is a testament to, I have about 150 people. We serve 13,000 veterans. We'll serve about 30,000 this year very efficiently. I think what he's trying to do is be more efficient with what they have and leave more funds on the table for veterans, for prosthetics, for housing for them, for their care, for mental health, for community care. You can't just have this bloated bureaucracy. 500,000 people is bigger than the active duty Army.
Yeah, so
It's too
focusing on
many
the
people.
actual benefits rather than the overhead.
Correct.
How'd you feel when you left? Do you have a good feeling about what's going to happen now?
I feel like having him at the helm puts the ship on the right course. I do think there's a many icebergs out in the way because of all the grandstanding and gaslighting. They don't actually seek to understand or have a conversation. They mostly just have a one-way linear conversation and let him speak very little. But I think if he gets to do the things that he's setting out to do, it's going to be excellent for veterans. I think veterans have never been safer than they are under this administration's watch, under Doug Collins' watch.
All right, Kate Monroe, thanks for being here with us today.
Thanks so much.